Joseph Borrell once said COVID-19 will reshape our world. We don't know yet when the crisis will end, but we can be sure that by the time it does, our world will be very different. COVID-19 has been the pandemic that turned many individual lives upside down, from the overworked healthcare professionals to issuing new restrictions to an overall change in the way the world operates. Hello and welcome to On the Record. I'm your host, Jerome Sawyer. As time passes, COVID-19 has begun to creep into so many Bahamian homes. No longer are we just talking about the elderly at risk, but as new strains emerge, children and young adults have been affected with the worst possible outcome. As with the rest of the world, the administration has promoted vaccinations as the way out of all of this, but major hesitancy in Bahamians has set in and set us back in so many ways. The critics and self-proclaimed experts from the University of Facebook and WhatsApp continue to push misinformation, uninformed hypotheses and outright lies. Tonight, joining me, an expert in the healthcare field as we discuss the realities of COVID-19. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. I'm your host, Jerome Sawyer. Tonight we're discussing the realities of COVID-19. With general elections approaching, politics has sadly become intertwined in our attempt to beat this virus. So tonight we are asking, what is next for COVID-19? Are we turning it into a political war? And if it has, should we be divided because of our different political interests, or should we come together in a single effort? My guest for this show is no stranger to healthcare politics or even On the Record. Joining me tonight, once again, Dr. Duane Sands, former Minister of Health. Dr. Sands, welcome back to On the Record. Good to have you with us again. Out of the box, let's talk about where we are in terms of the rate of infection, the death rates in this country, and let's look at it in the context of the rest of the world.
Well, good evening. We are in a difficult place in the Bahamas right now. A recent review by the New York Times looking at data from Johns Hopkins and other places shows that at the current 7-day average, the Bahamas finds itself having a death rate ranking 11 out of 195 countries in the world, and a case incidence rate of 22nd out of 195 countries. So we are doing poorly relative to the rest of the world. And I think it is very clear, based on the suffering of families and the discussions of people that have lost a mother, a father, a sister, a brother, that COVID is perhaps the single greatest issue in the Commonwealth of the Bahamas today.
Dr. Sands, what happened? A few months ago, our numbers were down, death rate was down, hospital was empty. We seem to be doing well. What happened?
Delta happened. And I say that deliberately and categorically, even though if you ask me to point to the lab test that says that Delta is in the Bahamas, while we may not have the confirmation yet, I have very little doubt that this is a consequence of the Delta variant spread throughout our larger community.
Highly contagious iteration of the vaccine, of the virus, but we have had the vaccine for several months. Again, what has happened? When the vaccine was touted to be our way out of this.
The Bahamas, like every other country in the Caribbean, has to deal with the reality of COVID-19 being a politicized disease and a social media fiasco. And so you put those things together, and the vaccine is perceived as, depending on who you listen to, either a panacea or it is the work of the devil. And it seems as if those two factions can never meet. And so you listen to one person and they're saying, oh, they're trying to sterilize black people and brown people, and they're trying to put microchips in your arm so they can follow where you're going. Or that it's the mark of the beast. Or I could go on and on and on. That Bill Gates and George Soros, and they trying to do all kind of things to you. This isn't a real vaccine. I could recite the conspiracy theories. But that misinformation, that disinformation is being promulgated throughout the internet and social media. And Bahamians are eating it and drinking it and sleeping it. And it forms a major part of the discussion every day.
As much as it pains me to even ask this, because never in my life did I think that I would be sitting and asking to what degree is politics involved in us getting to life-saving, to a place of saving lives, but how intertwined has politics become in all of this, taking even into consideration that people are refusing the vaccine, it seems, because of politics.
Politics of COVID has made itself the single greatest political issue of this century. You look at the United States, that was the case. You look at Great Britain, that was the case. You go to Brazil. You go from country to country, and it's true also in the Bahamas, that politicians sometimes believe that their political fates will rise or fall depending on how well they manage the COVID issue. And the polarization has been phenomenal. It has been tremendous. When I spoke in the House of Assembly yesterday, I called for a laying down of the swords, as it were. That I believe that the FNM and the Progressive Liberal Party, the two major political parties, ought to seek to find common ground. Because as this thing gets worse, and we have no idea how much worse it's going to get, but if I can put on my, turn on my crystal ball, as it were, based on the trajectory of this wave, I think it's going to get, unfortunately, a lot worse. And so people now need to come together so that we can figure out how we can put the interest of the Bahamas and the Bahamian people first.
When a doctor tells you a situation is going to get worse, that's a very disturbing thing. And for you to sit here and tell us that this situation can get worse is very disheartening and even frightening. But let's come now to the politics and the politicians. I'm going to start with your party and the FNM. The FNM, has been touting that we kept you safe. We've seen the ads. Our prime minister is a doctor. Did the FNM play politics with this by saying, we kept you safe, or we got you through the wave, or we did these things? Let's start with your party first.
I think it would be disingenuous to deny that there has been a political spin placed on the management of COVID. Certainly, if you look at the ads, that has been a significant part of what's in the public arena. Now, how much and at what point does it go from reasonable to state the facts to a bit too far? Then I think each observer will have their own view of whether we've gone too far.
Do you think it hurt heard the process, and people who are opposed to the FNM, don't like Prime Minister, whatever, may say, you know what, I'm not going to participate in this. Do you think that there are people out there who say, you know what, this is an FNM thing, I'm fooling with this?
The politics of COVID doesn't help the interventions for COVID. The work will speak for itself, I believe. And it is clear what you've done. It is clear what you've tried to do. Let that speak for itself. But this is perhaps one issue. And I know that sounds like I am some idealist, some utopian idealist that is holding hands and singing Kumbaya. But if we don't get everybody on board, I think we are going to see considerably more suffering in this country.
So let's talk about the PLP for a moment. We've come out about the FNM. Let's talk about the PLP. I think there was a recent survey which showed a lot of people who were resistant to the resistant to the vaccine, may be PLP supporters. Has the PLP done enough to encourage people to go out there and to take the vaccine?
No, I don't think they have.
Why?
I don't know why.
Again, why do you think they haven't done enough?
Well, certainly yesterday in the House of Assembly, the leader of the opposition, I believe, gave a reasonably full-throated endorsement of vaccination. But we have been waiting for quite a long time for that to happen. There are candidates, one very, very prominent candidate for the Progressive Liberal Party who is a staunch anti-vaxxer. And I believe that his voice has been instrumental in the perception that the PLP has not embraced vaccination as strongly as they should, because there has been no person in that party to say that he does not speak for the organization.
So let's talk about, we're going to call his name, well-known attorney Wayne Monroe, who is the PLP's candidate for Freetown, who was hospitalized with COVID, and it was in the media saying that even though he'd come to that experience, he was not going to take the vaccine. When something like that happens, when a person of his stature who has that kind of following says, I am not taking the vaccine, what does that do to the effort of the country and others to try and get people vaccinated?
Well, it may have an impact, but I think we have to encourage all aspects of this conversation. However, we need to be aware of the intended and the unintended consequences. I recall a conversation that I had with Nahaja Black early on, I think back in November or December, before mRNA vaccines were even available in country. As a matter of fact, mRNA vaccines had not even been administered to a single soul anywhere in the world. And we talked about how this was novel technology, and I said that I wanted to get more information before I would be comfortable. People have claimed that, oh, you were anti-vaccination. Never have been anti-vaccination, but the impact of commentary by a leader, a politician, an individual who has some gravitas in the community, you cannot ignore the weight of their commentary.
Do you regret having said that, or if given an opportunity, would you have said it differently?
No, I don't regret it at all. And if you go back and listen to what was said, it was very specific. At that time, my view was that I wanted to take the AstraZeneca or the Johnson & Johnson. Interestingly, that was the vaccine that became available in the Commonwealth of the Bahamas. Now, 4.3 billion vaccinations worldwide later, I have now had 2 shots of AstraZeneca and 1 shot of an mRNA vaccine, Pfizer. That was a journey, a discussion. And as we now have additional doses of vaccines, I think the conversation has allowed us to evolve in our thinking. So let's continue the conversation, but let's make sure that we don't confuse and polarize people unnecessarily.
So, in addition to the conversations over the vaccine there have been lots of criticisms levied to the Minnis administration over the handling of this, the safety protocols, the things that have been put in place, the changing of the orders. Sometimes it seems on a dime. You yourself, even after leaving the cabinet, would have criticized some things of the administration. Let's start with you first. Looking back now, do you again think that that was a wise thing to do? Criticize your own party and government at the time?
I think one has to be intellectually honest, and integrity in public life is not without its ups and downs. And so you're going to get criticized for whatever position you take. What's important is that you speak from your heart and your head, and that you're not, putting your finger up to determine whether or not this is going to sound good or whether it's going to be perceived properly. So, in baseball, the MVP bats .400. Okay, you don't get it exactly right all the time. But if you speak from conviction, if you speak on what you truly believe, then I think there's a pattern of consistency that plays out over time.
We are now in another wave, as you and others have said. Just short of the actual evidence, we believe that the Delta variant is to blame for what we are seeing. Prime Minister has addressed the nation on 2 occasions in the past few weeks. Many would have feared or thought that there would have been a lot more stringent measures. I think one of the most overriding thing, or the thing I remember the most, is the reduction in the time to curfew. Should we be doing more from a public health perspective? Should there be more protocols and things in place? What should we be doing?
I think this is very fluid. It is incredibly fluid. And I have been calling for more restrictive measures now for the better part of a month because the healthcare providers are, as I call it, the canaries in the mine. We see some things before many other people see them. I am very much aware of the balancing act that has to happen. And as long as we are willing to act, change, modify, either move a little bit this way or a little bit that way, I think that's really the key, is that you're going to be responsive. One of the real criticisms I would levy against this government is that the data, the information on which it has based decisions, has not been made public, not made sufficiently public. And so when an intervention takes place, the statement is, on the basis of advice, we did the following. Well, what was the advice?
I think that's it. A lot of people are angry because they just don't understand what is... For instance, people complain about the curfew, saying, well, does the virus go to sleep at night? Why do we need to have a curfew? Why do we have to be home at 10 or 11 o'clock?
And it allows for these kinds of peculiar statements. There are some bona fide reasons why a curfew 1 hour earlier makes sense, because you reduce the time that people can spend in restaurants and bars and socializing and so on and so forth. But if you don't say that, then people make up their own stories. So one criticism I have is that the data, the metrics that we are using to determine that we're going to do this or we're going to do that has not been made available to an intelligent public.
Back a bit to where people sit in all of this. When I hear people say, I'm doing my own research, I get a little worried because I'm saying to myself, research where? What are you looking at? Where are you getting this information from? Just Google? What are the dangers of this? Or, how do, as an individual, how do you, when you hear people say, I'm doing my research, what then becomes your responsibility? What's next? I mean, where are you looking?
It is the nature of the times. I mean, the internet is a tool that's available on laptops, on cell phones, on desktops, on tablets, and everybody is now an expert. Arguments no longer rage on for more than a few minutes. I just Google that, and it says the following. Now, you haven't defined the validity of the source, whether or not it's an objective source, whether the level of evidence is reasonable. There's just an article published by some person somewhere that says the following. And I think that it has created a situation where it's not just you have your opinion. You now believe you're entitled to your own set of facts.
And therein I think comes the challenge as well, because everybody has information, but how do you determine what's factual when, and this is so true for social media, the algorithms of social media will take you to information that supports what you believe.
Precisely. And many of us do not understand that when you search for something, there are ways to get a particular type of information to pop up first. And that is what makes social media search engines economically viable. I now pay to get a higher rating when you search COVID-19, treatments for COVID-19. Boom, the first thing that comes up. So this must be the right one, right? So we have to be able to think critically and analyze. It's more than just getting information, because some of that information has been planted in order to get you to feel a certain way.
We've got to go to a break. I'm going to sneak in one more question. There are many healthcare professionals who are not vaccinated, who are anti-vaxxers themselves. What is the danger of that when your doctor, your nurse, people in the healthcare profession are saying, oh, I'm not taking it either?
Interestingly, a significant number of healthcare providers, doctors and nurses, locally, in the region, and across the African American diaspora, are not vaccinated and are anti-vaxxers. And it poses a serious challenge to the messaging. It also makes you wonder whether or not they are performing their duty. We just heard the other day about a nurse that was injecting saline as opposed to COVID, not here in the United States, in some 8,000 persons. Now, this person obviously had a very strong feeling that this vaccine was the devil's work. And so I won't let you harm yourself, so I'm going to inject saline into you. How many of those people got COVID? How many of those people died?
So we're going to take a break. Good time for us to take a break. When we return, we're going to discuss the current state of COVID-19 in the Bahamas. We're going to continue on that discussion and looking at what it's taking to regulate it all. Stay with us. More on the record right after this. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back. You're watching On the Record. I'm your host, Jerome Sawyer. Tonight, our continuing discussion on the realities of COVID-19, the Delta variant, now most likely in country and known to be one of the deadliest variants of COVID-19. The question is, how do we go about dealing with this pandemic? Dr. Duane Sands, my guest for this segment again. Sir, you have been intimately involved in treating COVID patients. What has it been like for you? And others like you, having to deal with gravely ill patients, patients to the point of death, or even, patients who are dying, dealing with them and even their families?
Jerome, it has been for many members of the health team an exhausting experience. not just physically exhausting, but emotionally and psychologically exhausting. Understand that this has been going on now for 16, 17 months. And we've seen the first wave, and then the second wave, and now we're in the thick of a horrible third wave. You've seen a lot of people die. You see mothers and brothers and sisters die. You've seen a number of people in the same family die. You listen to the pleas. Just yesterday, I had to speak with a young lady who would have contracted COVID at work, only to find that her father and mother were infected, and her father has now died, and her mother is in hospital. And she is obviously distraught, wondering whether the most important person in her life, that's all she has left, is going to survive. What you have to do is you have to summon up whatever residual emotional energy you have in order to help. But then you go to the next room and there's another story and another story and another story. So in the course of a day, you have some clinicians who are caring for COVID patients all day long. And many nurses in particular now find themselves so exhausted mentally and physically that they have to summon up the courage and the strength to keep pushing on.
Do you think people realize the toll that it's taking on you all?
No. And I think we have, we bear a little bit of the blame because we have sanitized, isolated people from that reality. Mm-hmm. When you look at the response of persons to people being on the porch, as it were, whether in truth or as a metaphor for having to wait for care. The truth is in the Bahamas that with 138 people in hospital, many of them critically ill, that we are out of resources. The minister yesterday made it clear that a number of the beds don't have staff members to take care of the patients. And as this thing gets worse now, you're scrambling to find a bed to put my mummy with COVID, or my auntie with a heart attack, or my uncle with a stroke, and so on and so forth. And so as we watch the illness, the psychological impact, we realize that COVID has now consumed all of the oxygen in the room. And in a post-Dorian Bahamas, where we are already traumatized, COVID is psychologically and emotionally damaging all of us again.
In the beginning, we were concerned about the elderly. People with comorbidities were the ones most at risk. Nowadays, you see young people, 30s, 40s. You see children, and even most recently pregnant women who are now susceptible, who are ending up very ill or dying.
Correct. We have had more than 125 pregnant women present to hospitals COVID positive. A number of them, more than 5 of them, have died. We have seen children less than 18 critically ill, fighting for their lives from COVID. We've seen people in their 20s die from COVID in the Bahamas. And so what used to be a disease of older people or people with comorbidities, and I believe this is the Delta impact, Delta variant impact, we are seeing young people, so-called healthy people now, stricken by this COVID. And we don't see the end of this anytime soon.
There is the belief that, or it's being propagated, that even those who are vaccinated are still at risk. We do hear of cases where people who are vaccinated who have contracted the virus. Let's talk about those who are vaccinated versus those who are unvaccinated, their chances of survival if infected.
Based on the definition of vaccinated, meaning that in the case of AstraZeneca, you've gotten 2 shots and you're more than 2 weeks after the second shot, your chances with infection, even with this variant, is night and day different than if you are unvaccinated or partially vaccinated. And so on the order of magnitude of 99% to 1, your chances of being hospitalized or dying after vaccination is very, very, very low as compared to people that are not vaccinated. The problem is that you're seeing all of this confusing information that's coming at it from people who deliberately want to provoke hysteria and fear and to create mistrust. But the data from the CDC, from the NHS in the UK, from the WHO is very, very clear. Vaccination has been effective. It works. It saves lives. It reduces hospitalizations.
The confusion, I think, for many people came in when we found out that, or we saw the rate of infections go up for people who were vaccinated. Because like myself, after I got fully vaccinated, there was a sigh of relief. I thought, I don't need to wear my mask as much. I started to travel. I didn't feel as fearful. You know, I hung out with my other vaccinated friends. But all of a sudden, it was as if we got a bit of a slap in the face when we thought, hey, you can still...
Remember that we were trying to provide incentives to people to get vaccinated. You can get your life back if you get vaccinated. You ain't got to wear no mask.
The pandemic over.
Okay? And unfortunately, the truth, the evidence doesn't support that. Wow. What it says is that, yes, you're going to be safe. Yes, you're going to be free of hospitalization and likely free of death, although a tiny, tiny, tiny percentage of that 4.3 billion people will wind up dying or hospitalized, 0.000 something. Now it's more nuanced. Get vaccinated, keep wearing your mask, keep washing your hands or sanitizing, and stay away from people you don't know.
Why, though, can't we seem to get the messaging right? Because I think, you know, like everything else, the messages keep changing, and depending on where you stand on all of this, you cling to the things that make you comfortable. Because again, as someone who has always wanted the vaccine and had no hesitation, I thought, okay, good, I gotten it, I'm good, I'm clear. And then a couple of weeks ago, I thought, okay, well, I seem to be back at the same place I was.
This is politics and social media again. And so if you look, let's look at the debate going on in Florida, where you have the governor threatening to sue anybody that is insisting on children wearing a mask or people wearing a mask. How can it be that we are so polarized that you go to the next state and there's a mask mandate? The politics of COVID has so consumed us that, you know, people that have one political ideology believe on average one thing, and people with a different political ideology tend to believe something different. Now, whether that political ideology is Democratic versus Republican, conservative versus liberal, I could go on and on and on. It seems as if we have become so tribalistic that facts no longer matter.
And there's another political player that I want to speak to as well. You have churches, religious leaders who are dissuading people from getting vaccinated, who are telling congregants, you know, the Lord will protect you. Jesus got you on this. You know, you will be protected. Your faith will protect you. And you have people who actually believe that. What is the danger even of these individuals? Again, people have the right to choose, but when you have a religious leader, a pastor, a reverend who leads a flock, a congregation, I mean, openly say to them, you know, the Lord will protect you.
I think that it speaks to the complexity of the message that people are receiving. And if your spiritual leader is telling you that Jesus is going to see you through this and you don't need to get that needle in your arm, there will be people that are genuinely conflicted because my spiritual leader told me that. He or she wouldn't lie to me. So why would I believe these secular people, particularly these politicians? And it is one of the reasons why we've got to turn the temperature down, and we've got to understand that if we do not come together, if we don't find that middle ground, if we don't find that common ground on which we can agree, the suffering is going to escalate tremendously in this country. You
know, Dr. Sands, and I'm not ashamed to say this, I find myself And I'm sure there are others like this. I feel so strongly, and I don't always say it openly, but I find myself now losing friends. I may not openly say it, but I see their comments on social media. I see the positions that they take, and I say to myself, I can't be friends with this person anymore, or I can't, if it's a family member, I can't invite them over to my house anymore. And it seems like there's a divide, because I find myself congregating, talking to, commiserating with those who are vaccinated. And I've gotten to the point where I don't even want to be bothered anymore. I'm like, go do what you got to do over there. I'm going to stay on this side. And that conflicts me as well, because I'm like, this can't be right.
We have created the perfect storm where not only do I disagree with you, but I think you're stupid. I believe you're a jackass. I believe you're an idiot because you have a different view than I have, and because you're so dumb that you cannot understand the correct way of thinking. And this whole scenario that I've tried to describe with the social media, the disinformation, the misinformation, and the politics of COVID has driven an incredible wedge among human beings. When you add to it the psychological impact of the economic consequences of COVID and the family dynamics that have arisen because of everything that's gone on over the last 18 months, we are watching yet an increase in psychological and sociological negativity. And we are going to pay an incredible price for this coming forward. Suicides going up, spousal abuse going up, child abuse going up. And we thought we had it bad after Dorian, remember? And now, another blow. So watch what happens. We have to increase our efforts to turn down the temperature, get people talking to each other. Let's argue about Junkanoo again.
Yeah, I good with that. I still a Valley boy. I have no problem rowing with that. But I'm with you on that. But it just seems so that we are so polarized that we can't seem to move past this. But we've got some more things to talk about. I do want, when we come back from this break, I do want to talk about the effects on the actual healthcare system and where we are, particularly in public health. Stay with us. Our final segment of On the Record right after this. Every new season of On the Record, we push the limits, venture into unknown territory, take our cameras into places unseen before. We share the stories and experiences that affect us all. And now it's time for Season 5. On the Record, Thursdays at 8 p.m. on RTV, cable channel 212, and streaming live on Facebook. Welcome back to On the Record. This is your final segment. I'm your host, Jerome Sawyer. Tonight, our continuing conversation on the realities of COVID-19. Recently, with a record-breaking number of cases recorded in one day, the healthcare system is on the brink of collapse, and the morgue over capacity. We are questioning tonight what is next for the country. How do we move forward? How do we get out of all of this? Is there a way out? This final segment, of course, we continue our conversation with Dr. Duane Sands, a preeminent physician and doctor and former Minister of Health. Sir, Public Hospitals Authority recently put out a statement asking people to collect their loved ones. The morgue is over capacity. I think it's built to hold 75. It's like almost
245, I believe.
245 people, bodies still in there. What does this indicate to us?
It speaks to a system, and let's not only focus on the public healthcare system.
Sure.
Because the same impact is being felt in the private healthcare system that is being overrun, overwhelmed by COVID. When we look at the impact of COVID, it is the illness and death from COVID. It is the illness and death because of the prevention of people getting access to care for other conditions. And it is the negative impact and the psychological issues from COVID that results in suicide, that results in homicide, and so on and so forth. You put that all together, and you see that with the current number of cases, the current number of people hospitalized, and a trajectory that's getting worse, and you understand the impact on the healthcare system.
Two things. Why, at this point in our development as a nation, why is it that we still find ourselves in such a crisis with our healthcare system? One, and two, we've been in this pandemic, as you said, 16 plus months. Why are we not better prepared?
I think that if you look around the world, decisions are made on the basis of best available information. Nobody really anticipated Delta and the massive impact that Delta would have on India, on Florida, on Texas, on the Bahamas.
But we saw it coming. I mean, the moment we saw India.
Okay, but you still hope. That's far away, you know. That's over there. That's not here.
This virus started in Wuhan, China.
You look at the balancing act and people say, you know, I haven't been able to feed my children. And now you have guests coming off of planes and hotels opening up and taxi drivers able to earn a fare. And the hope is that better days are soon to be here. And you hadn't had cases other than 1 or 2 or 5 or 6 for months. And then that gradual climb. And so I think it is the unexpected negative impact of the Delta variant. I believe it is the consequence of the decisions that we made about not taking vaccines, not having vaccines, and you add that to a healthcare system that on a good day is already broken, already stretched. You put that all together, and you add to that the fact that we are among the unhealthiest people in the world. More diabetes, more hypertension, more overweight, more violent. You put all that together, and you have, and I've said this several times already for the night, the perfect storm.
A couple things. We ran out of vaccines, seemingly. People weren't able to get vaccinated at one point. Thankfully, we have enough now. Well, we have more now. Enough is relative. We have more now. We're bringing in the Pfizer and Johnson & Johnson. What effect do you think those two, introducing those additional vaccines will have? Because a lot of people continue to say, I don't want AstraZeneca for whatever reason.
I believe there will be an incremental increase in uptake, but there will still be persons that are vaccine hesitant, who we are going to have to reach out to, go into the communities as they are, to have personal conversations with them, one-on-one, to find out what their concerns are. Some of those concerns are real. You know, I had blood clots. I read that that's not a good thing. I'm worried about the AstraZeneca. I would prefer to get the Pfizer. Some may say I want the Sputnik 5, whatever. At the end of the day, every single country finds itself, other than Gibraltar or the United Arab Emirates, but every country in the Western world or democratic communities reach a point where they have a certain number of people vaccinated, and then boom, vaccine uptake drops off precipitously.
We see it. We see the lines increasing. We see people now seemingly, or more people wanting it now. Do you think there's a fear factor involved?
Yes, and there's a fear factor, there's an understanding. There's been some time. People wanted to wait and see. They wanted to wait and see whether Dr. Sands' arm is going to be twitching after he got the vaccine, and we didn't see that happen. There's so many things. There's so many things into it, and you know, sometimes a little levity helps, because if you don't laugh, you're going to cry at the seriousness of what's going on in this country. But you know, get vaccinated.
I have to ask this though: do you think we have overlooked some protocols for the sake of the economy? I mean, we're doing a lot better. Tourists are here, the flights are full, hotels are booming. There's money coming back into the economy. Have we compromised our health protocols for economic considerations?
I don't believe compromise is a good
Overlooked?
word. In life, in politics, it's all about choices. And you make choices based on an assessment of risk. You take advice, you listen to that advice, and at some point in time, you got to make a decision. If you make the right decision, you come out looking really good. If, in retrospect, you make a decision that does not have a good outcome, you don't look or smell so good afterwards. But it's about the choices that we make, and I think that's why it's important for us to get more input.
Every time I look at a decision the decision that's made, I ask myself, and I always wonder, to what degree does an impending election, to what degree does that influence a decision? The realities of politics being what they are, we are less than a year out from a general election. Every government and party wants to get reelected, but you know, I look sometimes and I wonder to myself, and I'm sure people do as well, to what degree is politics now pulling the strings of these decisions or factoring into these decisions?
That is an excellent question, and I don't think we will ever fully know the answer to it. Clearly, that you know, you have the devil on one shoulder and the angel on the other, giving advice, and hopefully you listen to your conscience as you make decisions. I would hope that those of us in leadership positions are guided by a principle that our decisions or choices should first of all be in the best interest of the Bahamian people and not in our own personal best interests. And sometimes that is very, very difficult when the decisions that you make may ultimately be politically unpopular, generally unpopular, or you may be seen in an unfavorable light for doing the right thing. It is another reason why I think we have to turn the temperature down and understand that none of us are going to benefit from the politics being ramped up right now. None of us. The privilege to serve Bahamians ought to be looked at with the litmus test of what impact did you have on the least of us. And if you can say that I tried my best to improve the lives of the least in the community and to alleviate suffering and to improve education and healthcare and so on and so forth, and it may not have been very popular, but it certainly was the right thing to do.
This government has had to deal with a lot of distrust and mistrust, and not just with COVID, but even prior to this, there were accusations. Just recently, the Auditor General's report indicated that the government had not been transparent with divulging who was behind some of the contracts relative to COVID-19 and some of the services and things provided. When you see something like that, you're sitting there in the House of Assembly. How does this now impact your ability to lead and to engender trust in people when they're going, but we don't even know who's benefiting from this. And that is a serious concern. So there are many people who are benefiting, whether intentional or not, from this COVID-19 crisis.
You know, Jerome, this is the second bite at the apple for having this question asked. And obviously, transparency forms the foundation of a strong democratic society and is always going to be helpful. The question, though, that we want to find out is, was there subterfuge, was there any malfeasance, etc.? Or is there the perception of such? I think the Auditor General has pointed out some discrepancies or some weaknesses that need to be corrected. And even though it's a day late and maybe $1 short, addressing those deficiencies even now would go a very long way in rebuilding a little bit of lost trust.
Do you know of any malfeasance or anything that would have been done during your time or even after?
No, and I do know that the time pressure to get things done forced you to make some decisions on the spot. Procurement of PPEs, for instance, in the early days. Let's go back to March, April 2020. People will tell you, look, you make a decision within the next hour, or I'm going to sell this to somebody else. You've got nurses, doctors, etc., police officers, customs officers that needed masks and so on. Oftentimes you had to follow your gut, and the decisions were made in the interest of those people who needed them. And oftentimes you didn't have the ability to do the type of due diligence that you would probably do now when the pressure is not so great. So no, I am not aware of instances where there was any deliberate attempt to conceal.
I hate to keep going back to this, but a decision sort of like that ended up costing you your job in cabinet.
And I guess if I had to do it again, I would do it again. You make decisions that you feel are the right decisions, and if you have to pay a price for it, well, I did it for the right reason. I certainly didn't do it to benefit me, because it didn't benefit me.
But do you accept, though, that there is this growing belief that there are people who, whether they are party contributors or friends or whatever, who are benefiting from some of the services being provided as a result of COVID? There is that narrative out there.
There is that narrative. There's the narrative that, oh, these labs are making so much money on these tests, and this is horrible. They're providing a service. The people that sell sanitizer, they're making too much money. The people who have identified opportunities as a result of COVID have benefited. And is that a bad thing? Some may say it's an unchristian thing. I mean, other people would say that's just being business savvy. I think the argument will continue, and there has to be give and take. But in every society, you will find that there are ethical persons and there are unethical people. There are straight people and there are crooked people. And it's no different in the Bahamas.
Dr. Duane Sands, thank you very much, sir. We are out of time. We could have had more time, but I think we did a pretty good job in covering quite a few things out there. The realities of COVID, I mean, that's how we started this conversation, and this is a conversation, unfortunately, that's going to go on for a long time. Thank you for the work, sir, that you continue to do. We appreciate it. The country continues to owe you a great debt of gratitude, and thank you in all of that for taking the time to come and talk to us. We really appreciate it. Got some valuable information, and hopefully we've convinced some people to take a different road in their thinking and in their outlook.
And get vaccinated.
Get vaccinated. Thank you. So that's going to do it for tonight's episode of On the Record. Special thanks to my guests and certainly to my technical and production staff. We'll see you again next week, same time, same place, right here on The Record.